Hello everyone, today I am going to tell you the details of DPT vaccine, diphtheria, tetanus and wholesale pertussis vaccine. In this vaccine, diphtheria toxoid 20 to 30 LF per dose. Here LF is the limit of flocculation, and tetanus toxoid 5 to 25 LF per dose, and wholesale pertussis bacilli more than 4 international unit per dose present. We can store this vaccine between 2 to 8 degrees centigrade temperature. Now, what is the dose, route and schedule of this vaccine? We have to give 0.5 ml intramuscular in anterolateral aspect of the mid thigh. Now, what is the schedule of this vaccine? We have to give 3 primary doses and 2 booster. So 3 primary doses at 6, 10 and 14 weeks we are giving as a combination pentavalent vaccine. So pentavalent containing the DPT with Haemophilus influenzae type B and also hepatitis B. And first booster should be given between 15 to 18 months of age, and second booster should be given between 4 to 6 years of age. So maximum age limit for the DPT is 7 years and minimum age is 6 weeks. After 7 years, we can give the either TD or TDAP. The details of TD and TDAP I am going to tell you later on. Now, how much is the efficacy of DPT vaccine? After giving the 3 primary doses against the diphtheria and tetanus, child get the more than 95% protection, and against the pertussis between 65 to 89% protection. But as we know, immunity wanes over a 6 to 12 years duration. So child needs the regular booster every 10 years interval. So after the second booster, we have to give the TD at 10 years, and at the 10 years interval, we have to repeat the TD. Protective titer against the diphtheria is more than 0.1 international unit per ml, and protective titer against tetanus is more than 0.01 international unit per ml. Now, what are the contraindication of the DPT vaccine? Absolute contraindication of DTwP is anaphylaxis. If child is having anaphylaxis with the previous dose, then this vaccine should not be repeated. DTwP. If child is developing the encephalopathy, then wholesale pertussis component should not be repeated, because encephalopathy is because of wholesale pertussis. So absolute contraindication for DTwP is anaphylaxis, and absolute contraindication for wholesale pertussis is encephalopathy. Now, what are the relative contraindications where we should not give this vaccine? If child is having the any progressive neurological disorder, what are the conditions in which we should take the precaution, but it is not the absolute contraindication, because these events are not going to be the permanent. If child is having persistent inconsolable cry more than 3 hours, not consolable. If child is having fever, temperature more than 40.5 degrees centigrade in the range of hyperpyrexia within 48 hours of the vaccine, or if child is having hypotonic hyporesponsive episode within 48 hours of vaccine, or if child is having seizures within 72 hours of the vaccine received, then these are the events in which we should take the precautions, because these events do not causes the permanent sequelae. No permanent neurological damage will be there. So we can take the precautions in such case, but it is not the absolute contraindication for this. Now, what are the adverse effects after the DPT vaccine? So some are the local adverse effect. At the injection site, child will have the pain, erythema or swelling, and these local adverse effects present in 50% of vaccine recipient. Similarly, minor adverse effect also present in 50% of vaccine recipient. What are the minor adverse effects? Fever, fussiness, anorexia and vomiting. What are the serious adverse events following the DPT vaccine? Child may have the hyperpyrexia, temperature more than 40.5 degrees centigrade. Child may have the persistent inconsolable cry. Child may have the hypotonic hyporesponsive episode. Child may have the seizures after the DPT vaccine or may develop the encephalopathy. These side effects are very rare and the frequency of these adverse effects per 1000 vaccine recipient are: hyperpyrexia can be present in 0.2 to 4.4% cases, persistent inconsolable cry in 4 to 8.8%, hypotonic hyporesponsive episode HHE in 0.06 to 0.8%, seizures in 0.16 to 0.39%, and encephalopathy in 0.007%. So these are the serious adverse effects present very rarely. There are some adverse effects which are not proven. So what are those? Autistic disorders, learning disability, neurological sequelae, Rey syndrome, SIDS, all are correlated with the DPT vaccine. But these adverse events are not proven, but people are having the doubts about these and also asked in the Viva. So this is all about DPT vaccine. Thank you so much.